Imagine you are about to have your leg amputated. The year is 1840. You are lying on a wooden table. There is no anesthesia. There is no understanding of germs. There are no sterile instruments. 4 large men are holding you down. The surgeon, who has not washed his hands since performing an autopsy an hour ago, picks up his blade, and the clock starts. Because speed is the only mercy available to you. And even if he cuts fast enough, even if you survive the pain, your chances of dying from infection in the days that follow are roughly 1 in 2. This is where surgery began, not in gleaming operating theaters with sterile gloves and precision instruments, in blood-soaked aprons, sawdust floors, and screaming that could be heard from the street outside. And tracing how we got from there to here reveals something that goes far beyond medicine. It reveals how human beings push through the darkest possible conditions to find something better on the other side, often at enormous personal cost. Today we are going to walk through the dark history of surgery, from the first crude incisions made thousands of years ago, through the most brutal era in medical history, to the unlikely discoveries that changed everything. Surgery is older than civilization itself. Archaeologists have found skulls dating back over 7,000 years, with deliberate holes drilled into them, a procedure called trepanation. And here's the part that stops most people cold. Many of those patients survived. The bone regrowth around the holes proves it. We do not know exactly why ancient surgeons drilled into living human skulls. To release evil spirits, to relieve pressure after head injuries, to treat seizures. But the fact that patients survived often enough that the practice continued for thousands of years across dozens of separate cultures tells us something remarkable. Humans have been cutting into each other and attempting to help since before written language existed. The ancient Egyptians left behind surgical papyri, dating to 1600 BC, describing the treatment of wounds, fractures, and tumors with a precision that still impresses medical historians. Hippocrates in ancient Greece established the first real ethical principles of surgery. Clean the wound, avoid unnecessary intervention, and above all, do no harm. For a moment in history, it looked as though medicine might advance quickly. And then the medieval period arrived, and it did not. For roughly 1,000 years, surgical knowledge stagnated almost completely. The church discouraged the dissection of human bodies, which meant that anatomical understanding barely moved forward. Surgery fell largely to barber surgeons, men whose primary profession was cutting hair, and whose secondary profession was cutting off limbs. They learned not from textbooks, but from doing. And what they did was brutal in ways that are difficult to fully imagine. Amputations were the most common major surgery of the era, and without anesthesia, the only tool a surgeon had to manage a patient's suffering was speed. Robert Liston was the most famous surgeon in pre-anesthetic London, and he was a legend for exactly this reason. He could amputate a leg in under 2.5 minutes. Crowds would gather to watch him work. He was considered a genius and a showman in equal measure. But his speed occasionally created consequences that became the darkest and most absurd stories in the history of medicine. During one operation, Liston moved so fast that he accidentally amputated his surgical assistant's fingers along with the patient's leg. Both the patient and the assistant later died of infection. A spectator in the gallery, watching in horror, died of shock on the spot. 3 people died from a single surgery. Historians sometimes call it the only operation in recorded history, with a 300% mortality rate. Before a procedure, patients could drink alcohol to dull the sensation. They could bite down on a leather strap. They could be given opium if the surgeon was generous enough. And they could scream. The screaming was so expected, so normalized, that surgical theaters were specifically designed to contain the sound so that it did not disturb the rest of the hospital. The word agony comes from the Greek word for contest or struggle. Pre-anesthetic surgery was both, but surviving the surgery was only the first problem, because the second problem killed far more patients than the blade ever did. In the early 19th century, the mortality rate following major surgery in European hospitals ranged between 25% and 60%. Not because the surgery was performed carelessly, but because no one yet understood that invisible organisms on surgical instruments, on surgeons' unwashed hands, and drifting through hospital air were entering open wounds and destroying patients from the inside. Surgeons wore the same blood-blackened aprons for weeks or months. They saw the dried blood as a mark of experience and skill. Some would probe healing wounds with bare fingers directly after handling corpses and consider themselves thorough for doing so. In 1847, a Hungarian physician named Ignaz Semmelweis, working in Vienna, made a discovery that should have changed everything immediately. He noticed that the maternity wards staffed by physicians and who came directly from performing autopsies on cadavers had a death rate from childbirth fever nearly 5 times higher than the wards staffed by midwives who had no contact with the dead. Semmelweis concluded that doctors were carrying something invisible from corpses into living patients. He ordered his staff to wash their hands with a chlorine solution before any patient contact. The death rate in his ward dropped to nearly 1%. He had found the answer, and the medical establishment rejected him completely. They dismissed his findings, mocked his theory, and had him removed from his position. He suffered a breakdown and was committed to a mental asylum, where he died at 47 from an infection caused by the same organisms he had spent his career identifying. The man who discovered how to stop patients dying from surgeons' hands died from one himself. 2 discoveries arriving within a single generation changed everything that came after. The first was anesthesia. On October 16, 1846, a dentist named William Morton walked into the surgical theater at Massachusetts General Hospital in Boston and administered ether vapor to a patient about to have a tumor removed from his jaw. The patient felt nothing. He did not flinch. He did not scream. When it was over, the surgeon John Collins Warren turned to the crowd watching in stunned silence and said simply, "Gentlemen, this is no humbug." Within months, ether was being used in operating rooms across America and Europe. The screaming stopped. Surgeons no longer needed to race against a patient's endurance. And for the first time in history, slow, careful, complex procedures became genuinely possible. The second was germ theory. Louis Pasteur demonstrated in the 1860s that disease was caused and transmitted by microorganisms invisible to the naked eye. A British surgeon named Joseph Lister read Pasteur's work and immediately understood what it meant for surgery. He began using carbolic acid to sterilize instruments, clean wounds, and disinfect his operating environment. His infection rates dropped dramatically. He published his methods in 1867. Surgeons who adopted his approach saved lives at rates that had never been seen. Surgeons who dismissed him, and many did for years, kept losing patients to infections that were now entirely preventable. From skulls drilled in open fields 7,000 years ago, to sterilized theaters and patients who wake up afterward, not knowing they were cut at all. The history of surgery is the history of human beings refusing to accept suffering that does not have to exist, even when the path forward required decades of resistance, dismissal, and personal ruin for the people who found it. Semmelweis was committed to an asylum for being right. Liston was celebrated for speed in an era when speed was all there was. Morton died in poverty, fighting legal battles over credit for ending one of the oldest forms of human suffering. The operating room you would walk into today was built on all of them, on what they discovered and on what it cost them to discover it.